Welcome! Today, we're exploring cell wall synthesis inhibitors, powerful antibiotics that revolutionized medicine. These drugs transform deadly infections into treatable conditions, saving millions of lives. Imagine a world without antibiotics. Minor injuries could be fatal, surgeries perilous, and childbirth dangerous. The discovery of penicillin changed everything, launching the antibiotic era. Understanding these medicines is essential for anyone in healthcare. They're prescribed daily worldwide, forming a cornerstone of modern clinical practice. We'll break down what these drugs are, how they target bacteria, and why they're safe for us. You'll learn their uses, types, and how to use them responsibly. Think of this as a detective story. Bacteria are the culprits, and our antibiotics are the heroes. By the end, you'll grasp why these drugs are among the most significant discoveries in medicine. You'll understand their power, limitations, and the responsibility that comes with their use. This knowledge is vital for the future of medicine and public health. Whether you're a student, professional, or just curious, this guide is for you. Let's dive into the microscopic battle between medicine and microbe. Let's get started. What are cell wall synthesis inhibitors? They're antibiotics that stop bacteria from building their protective cell walls. Bacteria rely on a tough peptidoglycan wall for survival. It's their armor. Human cells lack this wall, making it the perfect target for selective antibiotics. This difference is why these drugs are effective and generally safe for us. The bacterial cell wall is constantly rebuilt, especially during growth. It's like a brick wall. Without mortar, the structure collapses. These antibiotics disrupt the mortar, weakening the wall. As bacteria try to divide, their walls develop holes and weak spots. Internal pressure causes the bacteria to swell and burst without a strong wall. This targeted attack is both clever and devastating for bacteria. By exploiting this unique feature, we can kill bacteria without harming ourselves. That's the genius behind cell wall synthesis inhibitors. It's a simple strategy with life-saving results. Now, let's see how these drugs work at the molecular level. Let's get specific. How do these drugs sabotage bacteria? They target enzymes called penicillin-binding proteins, PBPs, the builders of the cell wall. Beta-lactam antibiotics, like penicillins and cephalosporins, mimic the natural building blocks PBPs use. The PBPs bind irreversibly to the antibiotic, jamming their machinery. Without these builders, bacteria can't cross-link their cell wall, leaving it weak and full of holes. The cell wall collapses under pressure, and the bacterium bursts, a process called bacteriolysis. This is why these drugs are bactericidal. They kill bacteria outright. It's a precise, targeted attack that leaves human cells unharmed. The result? Rapid bacterial death and infection control. That's the power of cell wall synthesis inhibitors. Next, let's look at the major classes of these antibiotics. Cell wall synthesis inhibitors come in several key classes. First, the beta-lactams penicillins, cephalosporins, and carbapenems. Penicillin, the original, is still used for strep throat and syphilis. Amoxicillin and flucloxacillin are modern workhorses for common infections. Cephalosporins are grouped into generations, each broader in spectrum. First-generation cephalexin treats skin infections. Later generations like ceftriaxone tackle meningitis and pneumonia. Carbapenems, such as meropenem, are reserved for severe resistant infections in hospitals. They're powerful and used cautiously to prevent resistance. Then, the glycopeptides, most notably vancomycin. Vancomycin blocks cell wall construction differently, binding directly to the building blocks. It's crucial for treating MRSA, a notorious drug-resistant bacterium. Each class has unique strengths and clinical roles. Together, they form our frontline defense against bacterial infections. Knowing when and how to use them is vital for effective treatment. Let's see how these drugs are used in real-world medicine. How are these antibiotics used in practice? For common infections, penicillins and cephalosporins are first-line choices. Think ear infections, strep throat, and pneumonia. In hospitals, more serious infections may require intravenous cephalosporins or broader-spectrum beta-lactams. Piperacillin tazobactam is often used for complicated or hospital-acquired infections. Life-threatening conditions like bacterial meningitis demand high-dose, third-generation cephalosporins, such as ceftriaxone. For sepsis, carbapenems may be used to cover a wide range of bacteria. Vancomycin is essential for MRSA infections, serious skin, bloodstream, or bone infections. Its unique mechanism makes it indispensable against resistant bacteria. The right antibiotic, at the right time, can be life-saving. Clinical judgment and lab results guide these choices. Using these drugs wisely ensures the best outcomes for patients. Now, let's talk about side effects and safe usage. While life-saving, these drugs can cause side effects. Most are mild: nausea, vomiting, or diarrhea due to disruption of gut bacteria. A serious risk is antibiotic-associated colitis, caused by C. difficile overgrowth. Allergic reactions, especially to penicillins, can range from mild rashes to rare but severe anaphylaxis. Some with penicillin allergy may also react to cephalosporins. Vancomycin can affect kidneys and hearing, so blood levels are monitored. Carbapenems may lower the seizure threshold in susceptible patients. Always take antibiotics exactly as prescribed and complete the full course. Never share or use leftover antibiotics. This fuels resistance. Responsible use is crucial to preserve these drugs for the future. Antibiotic resistance is a global threat. Our actions matter. Use these medicines wisely to keep them effective. That's how we protect ourselves and generations to come.